definitely very. All right. Okay. So I've been told that I have been muted this whole time. Oh, how do I get back to the presentation window? Which one here? Okay. All right. Anyway, let us continue with this very interesting show. Again, thank you guys for tuning in. We are working with a new platform today, and ideally we will have this worked out even better for tomorrow. We're very happy to have this new platform, and as always, thank you so much to the folks at the AIDS Education Training Center that could make all of this possible. Thank you to Christopher Atkins, thank you to Graham Patterson, and thank you to Sydney Soublé. This is the Noise Filter Daily Live Show with Dr. Dery and Dr. Griggs. Dr. Griggs will be on in just a moment. Apparently, the first couple of minutes of the show I've been muted. As I was saying, Doc Griggs and I do have a regular podcast. It's a 10-minute high-yield podcast that lasts. That's got very high-yield information, mostly stories looking at COVID-19 with a health equities perspective, as well as a racial equity perspective as well. So now that being said, we are starting on the global epidemiology. It looks as though we are rapidly approaching 5 million cases. You can see we added about 70,000 cases. We're just, obviously from the big picture, a little less than 100,000 cases per day. Well over, we increased by 2/3 every day. Our number of deaths are 319,000, and our number of new deaths have gone down. We're usually about 3 people die per minute, and now we're down to about 2 people die per minute. So, of course, this is good. This is looking at the total number of cases. Of course, what was referred to as an epi curve, and you can see that the epi curve is slowly increasing, which is what we predicted in terms of the number of total cases globally. As we mentioned in the previous slide, there does seem to be a downward trend in the number, of deaths. So this is, of course, good news, and I'm hopeful that this is news, that this is a trend that we will see continue over the course, really, quite frankly, the rest of this pandemic. Looking at cases in the U.S., we are above and beyond, well north of 1.5 million cases, with about rapidly approaching 92,000 deaths. We added about 16,000 deaths, 16,000 cases, a little bit more than is usual overnight, and we added about 704 deaths. That's far less. As you can tell here, we're now down to about 1 death every 2 minutes, or a half a death every minute. Again, going back, we're at 91, almost 92,000 deaths. When you place that, we are rapidly approaching the number of military men and women who died in World War I. Of course, Korean War, and then we had the Vietnam War, but we're rapidly approaching World War I. And of course, this does not take into account all the innocent civilians, both and other, and the souls that were on the other side, if you will, in all of these senseless wars, but namely World War I. When you look at the U.S. epi curve, I think it's fair to say that we are definitely seeing a downward trend. When we were right around here, we weren't really quite sure, and it looked like, it looks like we were going up and down. But I think when you look at a big global perspective, I think we are definitely seeing a downward trend here. I think that's good news. We have some stories coming up that's looking like that we're going to start seeing cases go back up again. But look at, we saw some of the least amount of cases that have been added almost since the beginning of of the epidemic. So that, of course, is great news. And I told you that the number of deaths have gone down, as you can see here. So we're definitely seeing a downward trend, both in cases and as well as in mortality here in the U.S. When this is our slide looking at the number of testing, Iceland has the best number of testing in the world with 166 million tests per million people. If you can see here, the U.S. is about number 39 in the world with about 36 cases of, 36 tests per million people. And it is true that while we have done quite a number of tests, it's certainly not when compared to a rate such as the total population. Some more good news. Here is the number of total of positive tests that we've had, about 1.5 million. When you add that to the total negatives, you get this number, which is about 11.5 million. And when you take 1.4 million or 1.5 million divided by 11.5 million, you get about 12%. We want this number to be under 5%. It's been hovering at 15 and 14% for the last couple of days. Definitely has gotten a lot better. When you look at the state of Louisiana, we are at about almost reaching about 35,000 cases, with a total number of deaths of about 2,500. You can see Jefferson Parish and Orleans Parish far outweigh the rest of the state with respect to the number of cases that they've had as well as the number of deaths. And it looks like Jefferson Parish is starting to break away from the rest of the state. When you look at the Louisiana epi curve, it looks like maybe there's starting to be an increase here. And I hope that that's not the case. I hope this is just a little blip, but we shall see in a moment. And these are the number of cases coming down in terms of mortality. I think that this is just a long road downward toward hopefully being negative and hopefully seeing less cases overall. This is the number of case rates, and Louisiana has really fallen down. So when you look at Louisiana, we're about 7,500 per million cases, and you can see we've really fallen. 1, 2, 3, 4, 5, 6, 7, 8, 9. We're 9th in the country now. We used to be number 1, and we were number 2, we were number 3. So the number of cases per capita certainly is falling, and that's really good news for the state of Louisiana. When you look at our mortality rate, we've been right behind New York, New Jersey, Connecticut, and Massachusetts, but D.C., the District of Columbia, has edged us out. And you look at us, we have we have a number of deaths at 555 per million people, as opposed to 551 here for Louisiana. So I think Louisiana is doing a good job here. When you look at testing rates, we are 1, 2, 3, 4, 5, 6, 7. We are 7th in the country with respect to testing at about 57,000 per million people in terms of tests, with a total number of tests of 265,000. I know that the governor, John Bel Edwards, is interested and wants us to get to about 200,000 tests a month, and I am hopeful that we will be able to get to that point. This is the country Brazil. We have been following Brazil just because I think right now it's the 4th country in terms of incidence, so it is rapidly rising as a really quite a problematic country with respect to transmission as well as mortality. But you can see they had a very good day yesterday. And so hopefully this will be the final count, and hopefully this curve will start going down. But late last week, we reported on some of the highest rates that they've had in the history of their coronavirus epidemic. And you also see that the rates of mortality have been increasing significantly as well. Fortunately, we are seeing a decrease in mortality as well. So with that is usually where we stop and bring Doc Griggs in. And we are, as I said, in a new format here. So I'm going to have Graham come in and help us out with respect to moving on so that we can bring Doc Griggs on board. I am seeing some chats coming in, so we do appreciate all the chats that are coming in, and do appreciate all the fine comments that we are getting. So with that, I am definitely needing Graham to come back and help out here, Graham. So if you are seeing this, if not, I can continue on. I really would love to see Graham here so that we can move on. And I think I would imagine that what's probably happening is that Graham is not hearing me, so we are kind of in a place where we are trying to figure out this new program that we got here. Graham, I'm definitely needing you. And I think we are here. So again, thank you. And I'm assuming that we are still live here to some degree or another. Graham, yeah, thank you. Okay, so how do we?
So now you are
right
live there. I'm gonna remove this and
hello.
All right, how are you?
I'm good. How are you? Can you hear me?
Yeah, I can hear you. It's a little bit of a stress day today, huh?
No, we're good. Good. This is all part of it. Look, based on the slides, I could really almost give I'm going to give a genuine smile, but the reality is that though the numbers are going down and we're smiling and I saw all the good news, if people do not take this reopening cautiously, it's very much going to be a short celebration. I'm cautiously optimistic is not the word. I don't know if optimistic. I'm cautiously happy for the moment because of some of the things that I've seen over the weekend, and we'll get to that as we go. I know we're on a truncated schedule today because we're learning. This is all part of our new COVID normal, and hopefully you guys and gals and everyone else will enjoy our upgrade. So we got 2 Gen Xers trying to be Zennials, and we're going to struggle. We have a guest at 4:30, and I guess we can include some of it as we go in.
So there are a couple stories I did want to, go over with you, but I'm not going to be able to show them to you. But at least we can maybe talk about them as well. And that is, one of the things that's happening is that in the state of Louisiana, our R0, we've been, I don't know if you remember, we've been showing the R0 to be somewhere in the 0.8 or so. The last time it was recalculated was yesterday, and our R0 is now at 0.96.
So what does that mean in people speak?
That means the R0 is going up, and when it's below 1, that means that the virus is unable to transmit from person to person on a population level. And it approaches greater than 1, that means that the virus is able to transmit. So do you want to help people understand what that really means?
Yeah, so that means stay home. The virus doesn't spread the virus. People spread the virus. The less people are in contact with each other, the more the R0 will go down, and we will not have to deal with this as long as we're going to have to if we don't pay attention to our social distancing and, most importantly, wearing our masks. And, of course, washing our hands.
So that is obviously a distressing piece of information that our R naught is going up. When you look at the number of cases, we look at the ventilators, and we have plenty of ventilators available. So for people that are going out, know that if you do get sick, we'll have ventilators for you. Our ICU beds were almost a little beyond 50%, and our hospital beds were about 2/3 as well. We have some interesting stories to go over. I know that Sydney will be jumping on in just a moment. We'll be introducing our guest, but here's a couple stories. I thought this one you'd be interested in. Talks emerged about the first virus vaccine tested in people. We talked about that this morning.
Yeah, so you kind of broke up a little bit, but I heard you talk about the first vaccine being tested in people. That's great. That means somebody is doing something. Oh, the stocks went up. Yeah, we actually read that, and it was a business article that we read it in.
I told you
they're probably most in people. Considering the fact that the economy is falling, I mean, it's a good news for that. But as far as the science goes, it just means that we've started the process of clinical trials, and it's not in animals anymore. It's phase 1 we've moved to, and we have to wait and see what happens. It's like a beacon of light in the distance, and it's going to be just like being in the water. It's far away, and it's going to be a bumpy ride, but it's news. It's news. We're trying you can't speed up science. Now, the stock market can go up and down, and the money can go however you want really quickly. Science takes time. It just takes time. We can't rush something as important as a vaccine.
That's right.
We'll just leave that there, and we can follow it.
I thought you would appreciate that story. I wish I could show you the headline, because it says stocks go up with vaccine success. And this morning, another story here. Auto workers return to work. States ease restrictions, and Texas plans to reopen sleepaway camps.
So yeah, those sleepaway camps. About Texas. So from what I read this over the weekend, their numbers are going up by the thousands, and they're still opening things. I got it, and I'm not really familiar with sleepaway camps, but it doesn't sound like it's too socially distanced. So I guess we'll keep our eyes on that.
Unfortunately, sleepaway camps are not probably where you want to be sending kids. You never did sleepaway camp?
Yeah, I did. Matter of fact, I think I was 9. I think I did it once, and frogs got into my sleeping bag, and that was a wrap. They didn't get in. I think they put the baby frogs in my sleeping bag, and that was a wrap.
Were you the kid they played jokes on?
One time. One time. Everybody has their turn. Everyone has
their turn in the barrel. You're right about that.
Yeah, you play with frogs. I'm not afraid of snakes, so they didn't play in that games, you know.
All right, some other stories here. Let's see. Listen to some good news here. In California, undocumented immigrants can begin applying for aid. That's some good news. California, of course, on the leading edge of stuff like that.
Yeah, that's good. Right? That's good news. Again, the virus does not discriminate. It's people virus. Again, I just don't want to. I'm really trying to hold it in. It's been a rough weekend watching. I know we've been cooped up for a long time, but a lot of people have just gone back to pre-COVID-19, pre-10 weeks ago, and we're not. The virus is still there, so it's a little distracting at times. Nothing has changed.
Here's a story that I thought that you would appreciate. I wish I could show it to you, but it's from Politico, and the headline reads, Texas reports single-day high in coronavirus deaths 2 weeks after reopening. The governor reiterated his focus on testing and downward trends in cases and hospitalizations.
So the more you test, the more numbers you will get.
Okay.
And then the more. I got nothing. I got nothing on that one.
All right.
We expected that.
All right. As everybody's, we are working on our new technology. It's a pleasure to introduce Miss Sydney Soublé. Sydney is one of the coordinators for the AIDS Education Training Center. Sydney also works as, or has worked as, continues to work as a stylist, a hairstylist, and as a beautician. Is that a word, or how would you describe your
I'm
outside
a
of
licensed
AET?
cosmetologist.
Cosmetologist.
I am still a licensed cosmetologist.
Right.
I'm
Keep
sorry,
yourself
y'all, the
focused.
camera's a little off.
Yeah, there you go. And there's also a bit of a delay too, guys. Just FYI. As again, thank you guys for tuning in. This is Noise Filter. This is the daily live COVID-19 show with Dr. Dery and Doc Griggs. Doc Griggs and I do have a daily podcast that you can sign up for on any podcast subscription site called Noise Filter. It's 10 minutes, high yield information, usually centered around health and equity, social justice, social, economic, environmental, and racial justice. That being said, Sydney, talk to us a bit about what you saw this weekend and you're a cosmetologist. What does one do as a cosmetologist?
Hair. Make people beautiful.
All right. Well,
or influence their beauty. Maybe that's a better term.
I think you need to go to work on Griggs over there too.
Yeah.
Gotcha.
Let it go, man. Let it go. I did. Let it go. I did.
As far as this weekend, with everything kind of opening back up, I've mostly been paying attention to social media and what the people are saying, because of course everyone in the community and other states around have been wanting to be beautified. They want their hair done and their nails done, but I don't think it's necessarily essential. But people have been running to the nail salons. I don't know so much about the hair salons. A couple of my peers have opened back up, but are only taking like one client at a time. Like really strict guidelines on coming into the salon.
Right. So how are you able to keep social distancing and maintain social distancing? Like if you were to go back to work cutting hair now, like I'm sure you thought about it. How would you do it?
I would definitely take appointments online only or through text, and try to keep up with that. Have everyone sanitize themselves before coming to the salon. If I do have more than one person, I would definitely space them out seat-wise. Provide masks if they don't have any.
So masks would be mandatory for you.
It would be mandatory. We're entirely too close to each other not to have on masks, so then I would have to have one and my clientele would. But
right.
I would kind of screen them before they even put their deposit in or anything, or make an appointment just to find out how the last 2 or 3 weeks have been for them, who they've kind of come into contact with, if anyone is sick, and then what precautions are they taking? Do they have a mask already? Are they wearing gloves? Like, some different things just to keep the cleanliness of my salon or my space together for other clients.
Now you said that if you would only take one client at a time. When I get my hair cut, I'm usually the only client for a barber. So is that different for when women get their hair done? Do they sometimes do multiple visits at the same time?
Yeah, it definitely helps the money flow when you can start on someone and put them under the dryer and start on another person. But as of now, I'm thinking that if there is a waiting area, you shouldn't have, depending on how big your waiting area is, you shouldn't really have anyone sitting too close to each other. If you can do one at a time, like not double book yourself, just take one client at a time. Anything
Right.
just to keep it down. But I think that everyone comes into way too close contact because it's a place where we all can kind of chit chat and get to know each other and talk about things that are going on. And we get comfortable, get a little laxed, and I just don't want to see that happen in the salons.
Right. Dr. Griggs, any questions or?
So when you said you would screen your clients, when you say screen, what did you have in mind? What would you have in mind? How would
So
you
a
screen?
phone consultation first, which is something that I normally do anyway, especially with a new client. I don't know so much to say what I would do because I haven't started taking clients. I'm still kind of skeptical about their safety and mine. But I do think that, like I said, finds out if they've come into contact with anyone that has corona or may have been in the hospital recently, have been feeling ill, although that can't really prevent me from getting it because symptoms don't show up. It's still just another precaution to take just to kind of weed out who might actually have it and who might be at risk.
So my next question is for you, Doc, actually. So what is the extent that we can go? Everyone's talking about what you're talking about, Sydney, it's a component of contact tracing, which we're all going to have to get used to, and we're going to have to get accustomed to for a while. To what extent can she go as a business owner or a hairstylist? Can she flat out ask, "Are you COVID positive?" Can she require that her clients be tested first before she'll see them? Like, how far does this go? This is now, folks. This is COVID-19, but this is an infectious disease process, and I want to go back to it's a different type, but Dr. Dery's had experience with the numerous different epidemics and pandemics. So how does she handle this, and what's the extent she can without violating some sort of law?
Well, first of all, I think that is, of course, an excellent question, and the way I see it is that I think that there needs to be, like some sort of measurement of a room, and I think one of the things that I haven't seen yet is in any one room, there should only be X amount of people. Do you know what I'm saying? But the most important thing more than anything else is that everybody's got to be wearing masks, and there should be at least 6 feet between people at all times. I mean, there's no question about that, especially in a social setting like that. But my question, listening to you, is it worth opening up a store or opening up a salon and flipping on the lights? I mean, just to have one person in at a time and one chair going? I mean, isn't it just better just to keep the salon closed?
I would suggest that. I don't want to discourage people that do want to open up their salons. I prefer that we keep them closed, but I also think that if going forward they are going to open up their salons, besides taking those measures of safety, also offer things like incentives for their clients and different things to kind of ease what's going on, because that is a place that's kind of like, my clients come to me for more than just getting their hair done, they come for that talk and that conversation and that community. So I don't want to necessarily say just shut it down, but definitely do some different things, invest a little bit more into what you're offering your clients, because you could potentially make more money dedicating more time individually, like I do already, because I go to my client's house currently. I was in a salon, but I offer hair on the go, and that's something that I take pride in because everybody isn't mobile. But with that, then that just means I have to step it up more. I can't be as relaxed as I was doing hair before.
Right. But when you're going but you haven't done any of that as of yet, right?
No, I'm planning on it right now.
What did you see with social media over the weekend?
Oh, the people were just trying to book appointments. And then I saw where some people were talking about if they were to have clients and they didn't come with a mask and they didn't provide the mask, then would they turn them away? And I'm just thinking about all the different things that we go through to make an appointment. And if you get turned away, like, how is that really affecting us? Because what if someone doesn't want to wear a mask? Like, I'm not sick, I'm well, I'm fine. Or what if
I would not treat them at all. No shoes,
like
no
refuse service.
Right, just like no shoes, no shirts, no mask, no shirts. I think as a business owner, you have an opportunity or the ability to kind of set the rules.
Right.
So I know wherever I am, there is a mandatory mask need to be worn whenever I'm around, because remember, this mask protects you from me, and your mask there protects me from you. And as much as I love the two of you, I do not want any of your spittle on anywhere on my body, let alone inside my mouth or nose. And I know that you appreciate that.
So we have a few questions, y'all. If you'd like to, they're very relevant to what we're talking about. They were asking, Lynette has two questions. One, she asked, how would you take the temperature of the client? Oh, no, not how. Would you take the temperature of your clients? And two, how could you verify any of the test results?
But see, my answer is simple. I'm not a medical professional, so I wouldn't say that I would take anyone's temperature and go with that. But
yeah, I mean, I think it's a great idea to take a temperature at the door. You use one of those little handheld forehead thermometers.
But just from all the different things I'm hearing, though, so what if I don't have a fever that day? Then
okay, so then it's not the ideal screen. But what if they did have a fever? Would you work on somebody who had a fever?
No.
Okay.
So I guess having a thermometer would be useful to rule out the ones that don't.
Yeah, I think Lynette's question is a very, very good one. Yeah.
And I did see someone out of state was using thermometers.
Yeah, I think a thermometer is a smart way to go.
I think so. We also have a question.
And Griggs has got a huge target to be able to put that thermometer. Like you can really aim that thermometer anywhere.
He keeps trying so hard. Does he not realize so I have a question. As a cosmetologist, a very serious question. Is he not far? He's not that far behind me. He can only swim so much. But we have another question from Gail. And Doc, I'm not sure if you've heard this, but Gail said, why is Dr. Fauci saying no masks necessary? I've not heard that.
I've not heard that either. I would be befuddled if Dr. Fauci and maybe Chris or Graham can look that up real quickly to see if that's actually the case. I have not heard Dr. Fauci say masks are not necessary. In fact, it's the exact opposite. And you're going to start hearing, certainly on these shows here as well as on our podcast as well, masks, and more masks. There's no question, masks save lives. Masks protect. You don't want what comes out of my mouth to come to you, because I may have COVID-19 and not know it. And I don't want you or the content of your mouth to come over to me because you may have COVID-19 and be inadvertently spreading it. So I would be befuddled if that's the case.
So I'm going to a mild pivot. And Sydney, we have you here because we've had to, you have to open the economy and you have to be safe. But Doc, we've been talking about masks, especially for the last 2 weeks. What percentage of the spittle, and if everyone wore a mask, let's go on your soapbox for.
Get on my calculator. Get on my calculator.
Yeah. Yeah. Get on the calculator. 6 times. No. 6 times.
So listen. Here's the bottom line. Masks are the only way that we're going to get to a rapid end of this epidemic, besides a vaccine. All right. The only way we're going to get to herd immunity is through vaccine or through innate transmission through the population, which we don't want to do because there's an unacceptable amount of risk of mortality. So we have to stop the virus at the source, and the source is the mouth, right? And so remember, this virus is overwhelmingly a respiratory virus, overwhelmingly. Mouth, and you touch something and here, and yes, that's maybe the case. Those are the minority of cases. What you breathing in somebody else's virus is overwhelmingly the largest risk of transmission. So the mask basically holds back almost 100% of your mouth contents inside of here. So after you're done wearing these for the day, you just throw it in, you wash it, or if you have a disposable, you throw it away in the garbage, not on the ground,
Not on the
because
ground.
on the ground, very problematic when we see them on the ground. Okay, but you take these, you put it over your mouth, and if everybody did this, everybody in the world, think about it, if the whole globe wore masks for 1 month, we would see cases decline rapidly. Doc?
Got a question now. Another good one from Lynette. She's on a roll today. What about the eye barriers now, along with the mask or the face shields? If people remember, when there was a shortage, our front line at the ERs, our doctors were wearing, and when we were out, when you were doing the screenings, you have the mask and you'd have the face shield. What do you think about eye barriers?
Yeah, I think eye barriers are important. I think that, we saw last week that there was a virologist who actually was on his way to New Orleans, was in a crowded flight from New York to New Orleans, and does not wear glasses. And he feels as though he was exposed to COVID probably through the eyes, because there are receptors that the COVID virus uses to get into the body. Those are called ACE2 receptors. They are found in the eyes. And so there is a possibility of viral transmission through the air and boom, and landing in your eyes. So as Dr. Griggs says, keep your germs to yourself. I don't want your germs, and you don't want my germs at all. You don't want them. They're mine. I don't want to give them to you. I don't mean to spit stuff out. I just do sometimes. I'm human. But hang on a second. Yeah, I can see myself waving.
Yeah, hopefully he can see how close he is to being as bald as I am, but keep going. We have a subject matter expert on the window right over here, right there. But we'll play nice.
Everything's backwards here, isn't it?
Yeah, it's kind of cool. Actually. So what is this a new recommendation? We do have a lot of people out now, and you had started saying that we need to start wearing masks a couple weeks ago. What about these eye shields? Is this something that we should be concerned about, that we should start looking for?
I think either eye shields or glasses. I think that I do believe that there is a risk of transmission through eyes. And I think that wearing eyeglasses may be or some sort of eye shield may actually be a thing. I've been seeing people wear masks that have like a little plexi thing in front too. Which I think is actually, you've got one? Yeah, I figured you do.
So to describe, and Sydney, thank you. So to describe what's going on, folks, when I say nothing has changed, I don't mean nothing's changed. We've made actually, in a short period of time, we've made a lot of progress scientifically in that process. We found out a lot more than we knew a couple months ago in a very short period of time. However, nothing has changed as far as our recommendation, because nothing about the virus, nothing about the way that we can mitigate and live with it or we attack it has changed. So what you're hearing, as we find out more symptoms, as we find out more manifestations of it, you might hear about not just restrictive social distancing behavior, but restrictive personal protective behavior as well. So this is all part of the scientific process.
I guess I was still going to ask Sydney some questions. I guess we lost Sydney.
No, I'm still
all right, good.
There she is.
Sydney. So any thoughts or any words or in terms of folks that cut hair and that run salons, have you noticed that there's like an acknowledgement of something and that there is a sense of really trying to take care of things, or has it just been like almost like a free-for-all, open the doors, business as usual sort of thing?
The few people I've seen, I think they're being precautious. I just think that everyone's so eager to get out and do something that's going to be where the difficultness come from. Because if people can schedule their appointments that have been waiting for over 2 months smoothly, the transition should be fine if people are taking precautions. But if all these people are trying to get in the salons, I think it's kind of overwhelming. I suggest that all stylists kind of take it easy. Don't be all over the place, because I've seen where someone had gloves on and was working and they switched to someone else's head because they had a chemical. But I'm like, you still have to change those gloves regardless. people aren't being mindful. So if they just stay mindful that Corona still exists, then we should be good. But I just hope that with all the incoming money that they don't start to get either greedy or just absent-minded and things get out the way. I think this is time for you to focus on your clients individually and, build that up.
Right. Yeah. Well, you couldn't say it any better. I know that Liana was showing me videos of the mayor visiting different businesses over the weekend. She was walking into salons, and she, it was interesting to see, the salons that she was walking into. They were showing these big distance and big barriers that they had. Mm-hmm. Everybody was wearing masks, so that was great. There was a restaurant not too far away from here. I was shocked that it had a ton of people, nobody wearing masks. Crowded bar, and I was stunned. Over the weekend, I talked to a colleague of mine who's an orthopedist, lives on the North Shore. We were talking about a patient, and then he was like, I'm out and about, I'm with the kids, we're at a crowded restaurant, it's awesome, we're just enjoying ourselves, what a beautiful day. And then he realized that he was talking to an infectious disease doctor, like his brain just clicked. He was like, oh, but we're all wearing masks and stuff, so, it's okay. And I'm like, no, you're not. He's like, yeah, we're actually not. And so I'm like, there we go. All right, there it is. Clock is now officially ticking. In 2 weeks, cases.
Going up. People want things to feel normal again.
Yeah. Which is really stunning. Sydney, before you sign off, any last words or any words of wisdom for Doc Griggs and I?
I think the best I can do is know that you are naturally beautiful and that you don't need us as much as we love your service and you coming to us. Being well is much more important.
There you go.
They will come to you later.
Everybody looks beautiful just the way they are. You look beautiful after your hair is done and your nails done and your tootsies get done. It all looks great, but right now, safety above everything else, right?
Yes.
Yep.
Yes.
All right. Well, thank you, Ms. Sydney. We'll probably see you hopefully tomorrow, and you'll give us another report tomorrow.
Sure. All right, y'all. Thank y'all.
Thank you. All right. Dr. Griggs, we have a couple more minutes. Any last words? There was one more story that there was here I wanted to show you. This was also in the Hill. It says areas that fail to social distance face 35 times more virus cases, studies suggest. Another piece of evidence that social distancing works. Another thing that that I really wanted to talk about, and that we should start addressing is this idea that the number of cases are being faked by doctors, and that doctors are engaging in Medicare fraud by falsely putting COVID-19 diagnoses when that doesn't exist. And I think that's somewhat problematic, and I think that is circulating the basic ecosphere of COVID-19 information. Have you heard any of that or any thoughts about that?
We have, but a lot of people are afraid to say things like that because I'll shut it down immediately. That goes back to, again, folks, nothing has changed. Mis and disinformation can allow people to get hurt. In other countries, I'd like for you to know there are reports of medical professionals when this pandemic has been at its peak. There are reports of people being attacked, doctors, nurses, respiratory therapists, medical assistants, you name it, people working at actually being physically attacked when they're leaving the hospital trying to protect the people that are attacking them because they're being blamed. So mis and disinformation can be injurious, it's dangerous, and it can cost lives. So shut any of that down. If it doesn't make sense, the conspiracy, now's not the time for conspiracy theory. Let's get through this first, and then we can figure it out, because there's another wave coming, and we're not out of the first one yet. So just focus on the facts.
Thank you so much. Dr. Griggs and I have a daily podcast called Noise Filter. You can find it on all of the podcast subscription platforms with the Apple as well as the Spotify platforms. If you could leave us a rating and a review, it will help other people find our podcast. It is a very high yield podcast where we're looking at either medical information or we look at stories from a social, economic, environmental, and racial justice perspective to talk about COVID. Again, thank you so much to our AETC team, Christopher Atkins, Graham Patterson. Thank you to our guest, Sydney Soublé. And thank you for all who have tuned in. Doc Griggs, as always, thank you so much. And we will see everybody here tomorrow at 4. And hopefully we will be a little bit, we'll have things a little bit better. Doc Griggs and I, along with Dr. Corey Hebert, will be on again tonight at 7 o'clock with Coronavirus Corner. You can find that on all of our respective Facebook pages.
Have a good day and stay home. Wash your hands and wear your mask. Stay home, y'all. Get
Peace out.
moving, wear your mask.
Peace out. Health is a human right. Later.